welcome back to it. It is your feel-good breakfast show, Expresso, live right here on SABC3. Now, we're shifting the focus over now to something very important, a conversation that's got to be had, and it is the incidence of breast cancer among South African women is increasing, and it is one of the most common cancers amongst women in the country. And early detection of the condition can lead to effective treatment and a positive prognosis. Now, here to help us unpack the topic of breast cancer, please welcome our trusted multimedia health specialist, Dr. Darren Green, and later we will be joined by cancer fighter Jade, who's going to be sitting here with us as well. Dr. Darren Green, so good to have you.
Morning.
Dr. Darren in the house. I love that this is an all-inclusive conversation because I think it's not something that just affects women. It's something that affects men as well. It's something that affects the family unit in general. Cancer affects everyone. So let's first talk about the signs. What should we be looking for when it comes to the signs and symptoms of breast cancer?
Yes, so depending on which subtype of cancer you have, the clinical signs that you perceive and pick up might only be later on in the disease if you're not screening. So screening is the thing that saves lives. So having a painless mass is the most common presentation. So a painless lump or bump in the breast tissue itself, which you can only pick up by regular screening, and we'll get into that, is one of the symptoms. Secondly, that could progress to having a painful mass. You could then have color changes on the breast tissue itself. You could have the contour of the breast changing. You know, the round contour can be altered with a protrusion. You could have dimpling, where if something is retracting, it actually sucks in, you know, the outer surface. And then, of course, you look at the outer appearance of the skin, the nipple, etc., the areola as well. So many people don't look in the mirror to even look at asymmetry of color, you know, the contour of the nipple and the areola, and those skin changes.
Yeah, it's those slight changes sometimes. But does a history of breast cancer in the family put someone at a higher risk?
Absolutely. So we hear that the terminology being thrown around, the BRCA gene. We also hear people speaking about estrogen receptors that you can test for in terms of who has that gene and who doesn't. And certainly your chances of developing breast cancer are significantly higher if you have the presence of that gene. 7 out of 10 breast cancers are estrogen positive. In other words, they respond positive to estrogen. So you'd like to know about that before starting on oral contraceptives, hormone replacement therapy, etc.
Yeah. Is it important to have a mammogram? And if so, are they painful?
Yes, so I haven't had one, but I can tell you I've seen many and helped people with them. What you need to understand that in terms of mammograms, they work really well in older women as a screening test. Remember that the breast tissue is denser in younger women, so often a sonar is used first and then a mammogram. But the disadvantages of sonar are obviously that it can overinterpret things and you have a lot of false positives, for example, which leads to then false or unnecessary biopsies. So the mammogram is a brilliant test. The future involves what's called the 3D mammogram or digital mammography. That's where we're going now, where you can pick up even smaller masses. It is a bit cold, uncomfortable, as the breast tissue obviously is placed between two plates, and that is obviously then
becomes very uncomfortable.
Yeah, but the value of that screening, it's not something you have to do every month or every week. It's something you do once a year after the age of 45, or unless there's actually a mass that you've picked up with your monthly self-examination.
Wow. Okay, Dr. Darren Green. Well, it is still Women's Month here in South Africa all throughout August. This conversation is an important one that must be had. And what we're doing in just a bit, part 2 of our conversation with Dr. Darren Green, is looking at treatment options and looking at how to detect and how to prevent breast cancer. So stay with us.
It's my feel-good breakfast show.
Welcome back to your Feel Good Breakfast Show. It's Expresso right here on SABC3. Joining our health segment this morning on breast cancer, we welcome cancer warrior Jade Wyngaardt, who battled cancer while being pregnant with twins. And she's here to share her remarkable story with us. So let's just give this beautiful woman a big hand of applause. Jade, that is absolutely incredible. I can't even begin to imagine what goes through one's mind when you're pregnant with twins and you hear the words, you have cancer. What happens?
I must say that it was devastating news. I think that any cancer diagnosis is devastating to the patient. It is what you do after that really defines your journey. And for me, positivity, the rallying of community. Actually, well, this is why I'm here today. This is why I have 2 beautiful babies at the end of what was a devastating punch in the gut.
Yeah. Then this, brings me to the question, what can we do to reduce the risk of breast cancer? Can physical activity reduce the risk? What about a healthy diet? What can people do to make sure they sort of reduce the risk and they don't find themselves in a space like that?
Absolutely. So, in a nutshell, lifestyle factors that you can modify play a massive a massive role in reducing risk. So, the big proven things to have a contribution to your risk are obesity, sedentary lifestyle, alcohol specifically is also increases your risk of breast cancer, and then genetics and knowing your family history, that you can get early screening done and even know whether your family carries the gene will help your decisions around the use of contraceptives as well as hormone replacement therapy. Age and smoking are the 2 other big ones. So over the age of 50 there's a higher incidence, and smoking plays also a massive role.
Jade, what were some of the treatments that you had to undergo in your journey?
So I went through the full spectrum, surgery, hormone therapy, chemotherapy, and radiation therapy. So, yes.
All while being pregnant?
Only a few while being pregnant. So I had hormone therapy prior to surgery, and that is to contain the growth or the spread. Went through surgery. And then I was supposed to get radiation, but then I found out I was pregnant, so my treatment plan changed. And then we went through chemotherapy when they were about 12 weeks old. I think that was you could only go through
during
chemo.
that period.
Exactly.
I mean, it must be quite a heavy thing to find out. Now you're pregnant and you find out that you are diagnosed. What are some of the risks to one's pregnancy when they find out that they've been diagnosed with?
Well, as you rightfully mentioned, radiation obviously is something that you can't have during pregnancy due to the effects that it can have on the growing or developing fetus, and also obviously certain chemotherapies can't be given either. So that's what you had to go through in terms of being managed by a highly qualified specialist oncology team that helped plan the pregnancy, I suppose, and also then obviously when you could start after the pregnancy. So.
I'm looking at you now. You're glowing. You're absolutely beautiful. No one would tell that you've gone through this absolutely harrowing journey if they had to look at you right now, because you are just a picture of health. Where do you currently stand in your journey with cancer?
So I had a reoccurrence, or first reoccurrence, August last year. So I'm just at the end of my battle with my second round with cancer. It had returned in the same location. Now, usually radiation therapy actually takes away. You can explain that, Dr. Darren. But it has come back, and now I've just finished radiation, and I'm back on hormone therapy. So smooth sailing. We're going to find out in 4 months if everything's good.
And of course, those babakis don't give you time to even think about it, because they want mommy's attention. And you've got 2 of them.
Yes, I've got twins, and this was with the cancer diagnosis. But I do have a 5-year-old and a 4-year-old as well. So it's a full house.
There's more.
It's a full house.
Wow, Jade. I mean, we did say that cancer affects everyone, and maybe it's a conversation worth having around the importance of having the right level of support within your family structure and your friends to keep that positivity levels all the way high up there. And this conversation is continuing with Dr. Darren Green, and of course, our guest Jade is here on your Feel Good Breakfast Show. Share your stories with us on social media. We'd love to hear from you on our Facebook page using that hashtag Expresso Show. We continue in a bit.
Wonderful stuff. Thank you so much to our incredible band Novocaine on the show this morning. We are continuing our cancer talk, and if you missed the few segments before this, we are joined by cancer warrior Jade Wyngaardt, who battled breast cancer while being pregnant with twins, which I think is a mammoth task. 2 babakis already at home, another 2 on the way, and of course here you stand. You're a picture of beauty and health, and even though there's been a reoccurrence, again, I know that you will continue to fight this with the support of your family and the medical team. But for any person that's watching right now who is going through the same journey and who is maybe feeling so lost, because I cannot imagine what it must feel like to hear those words, "You've got cancer." What would your words of advice be? Maybe 3 tips on how to proceed from here on out.
I can tell you what worked for me. Faith was a great deal. It was actually what anchored me through the process. And then reaching out to my family. I think sometimes we don't reach out enough as women, and it's important to reach out within your network of friends and family. And then also there are tons of support for persons with breast cancer. If you just ask your oncologist, they will refer you. There's so much support, and lean on that. It works. It really does.
You know, one thing that Jade's kept mentioning, Dr. Darren Green, this entire time we've had this conversation, is that if I hadn't gone and if I hadn't detected and gone for a check, I wouldn't be here today. And I think this speaks to a lot of women out there who might see one thing and just brush it off or think, oh no, I'm too scared to go. From a medical perspective, what do you think they need to be doing?
Screening saves lives, and Jade's journey just is testament to the fact self-examination is what saved her life. And that's what we need to promote. Remember, men are not immune to breast cancer as well. 1 in 8 women in South Africa are susceptible to breast cancer, and in the Western Cape, even up to 1 in 2 at the moment.
You mean men?
No, women. Okay. So the incidence has increased over the last year, and we need to be aware of that. So screening is essential. Know how to examine yourself. Know that it needs to happen at least once a month. Same as with testicular cancer in males. And often, obviously, you need to know how to do that. So if you aren't afraid, there's so many videos online. Even just ask your clinic, your local clinic, and it's a free test. You lay on your back, the breast tissue spreads over the chest wall, divide the breast up into quadrants, obviously, top left, top right, bottom left, bottom right. And then examine each quadrant one at a time, looking for the early signs of a lump or bump that isn't normally there.
Just for anybody who missed our earlier chat, what are some of the ways that we can reduce the risk of getting breast cancer?
Great summary. So I think the first thing is sedentary lifestyle, get moving. Sitting leads to an array of health problems. The second one, smoking, is really not on it. It increases your risk almost twofold. Then we move on to alcohol, which we never knew. Even consuming as little as 2 units a day has an impact on your risk for breast cancer. Along with that, obviously, understanding your age and your genetics about your family. So those are things you could work on actively.
Absolutely.
Very, very impactful. But you know what I've liked about this entire session is I've heard Leanne say a cancer warrior, because it's a fight, and you're fighting it and just getting out there at the top. Now, we've asked you on social media if you know any cancer survivors or warriors with incredible stories. We would love to hear those stories, and we have received some of them.
Here we go. Oh, I know her, Anastasia. All right, so this Palesa says, morning, my niece, Maleboheng, was diagnosed with osteosarcoma cancer in 2011 and was amputated 1 leg. She is a survivor, and now she's 20 years old, and she is a mother as well. She's a beautiful survivor there. Do we have another one? Teresa says, good morning, Expresso family. It will be 11 years tomorrow. I had breasts removed, and I praise God every day for his goodness and his love for me. Amen. I love that. Thank you so much for those beautiful, beautiful stories. Jade, you're amazing. Can I give you a hug? Such a beautiful, beautiful, shining, just example of life and this your passion to just continue every single day. And I know it's been difficult, but you're absolutely incredible. And of course, Dr. Darren Green, thank you so much for being with us as well.
And help and information is available. It is out there. Go on to cancer.org.za. They've got all sorts of resources out there, but they've got people on standby to help you to answer any of your questions, because we can all fight it together. We're going to take a break.